And as we've mentioned, the country has marked a grim milestone in the number of COVID-19 related deaths, having topped the 1,000 mark. That's more troubling. What's more troubling, I should say, is nearly a third of these fatalities were recorded in the month of October alone, 7 months after Kenya reported her first COVID-19 related fatality. Olive Barrows puts the numbers into context.
As the World Health Organization sounded the alarm on a spike in daily COVID deaths in Europe and the filling up of intensive care units, Kenya was crossing a worrying milestone of its own. On Saturday, Kenya not only recorded the highest number of COVID infections in a day, but closed a month that accounted for 28.6% of the total number of COVID fatalities witnessed since the first death on March the 26th.
We have been having a serious COVID problem in this country, and it is growing. We are going through that very difficult time of saying, now what do we do again? Do we close up? We shall be coming back to that, not today, but soon.
Remember, those who are dying of COVID-19 are people with the existing conditions. Previously, COVID-19 was not infecting as many of them as because the infection was still at very low rate. But now, because a lot more people are getting infected, especially the younger people, possibly they're actually transmitting these infections to the elderly who are now succumbing to death due to COVID-19.
Out of the 996 COVID deaths reported up until Saturday, 285 occurred in October, not counting the additional 17 reported on Sunday. Developments that saw Health Cabinet Secretary Mutahi Kagwe make a reappearance to the daily coronavirus briefings given by the Ministry of Health.
Up until yesterday, we have lost 54 lives to the disease this week alone. And I'm sad to report that today, once again, we have lost another 14 patients.
And those out on the front line have the best view of the building tidal wave. The healthcare workers counting their own among the 285 who lost the battle to the virus in October.
We have 1,467 healthcare workers cumulatively infected with COVID-19.
In the 72 hours between Thursday and Saturday alone, the number of those reported to be admitted to the ICU with COVID complications went from 35 to 41 to 55.
Over 80% of our beds are already occupied by COVID-sick patients. In the private hospitals, ambazo ziko hapa, hata kama uko na pesa, they will not be able to accept you kwa sababu the beds set aside for COVID are already full.
The more you have individuals developing serious COVID disease, some ending in ICU, some in ventilators, some in oxygen, these individuals, a proportion of them will eventually die if they have the pre-existing conditions.
But unlike countries in Europe, which are hunkering down to weather a second assault of the COVID wave, Kenya is only warming up when it comes to hosting super spreader events, presided over by none less than the head of state and his deputy.
I only wish that this issue of personal responsibility would be taken at heart.
Olive Barrows, NTV.